Hello viewers, I am Dr. Shailesh Kumar Garge. Today we'll see few of the questions which patient has asked in our YouTube. We'll try to see and answer their questions. Another patient, Mr. Ali Ahmad asked, I feel pain in left testis veins and I have done ultrasound 2 times but no varicocele found. So he's saying that he has done the ultrasound but no varicocele found or no obvious structural changes which is the cause for the pain. So I do get, this is a very common problem, and a lot of patients come to my clinic with the pain and their ultrasound is either normal or they have just grade 1 varicocele. So most of these times the pain is not because of the varicocele. There are other reasons for testicular pain as well, like muscle strain, nerve related pain, or sometimes a disc related, spine related pain can be radiating to the thigh and leg region along with the groin. Sometimes underlying hernia. So there are other reasons. These are the other reasons which are cause for the pain. So muscular pain is the most common non-specific pain in the testis, which sometimes with the rest or medications they subside, and some patients are very difficult to treat even because we don't know the exact reason for the pain in these patients. So varicocele is not the only cause for the pain. There are other reasons for the cause of pain which are not even detected on the ultrasound. I hope I could answer your question. If you have any other doubt or question regarding the varicocele, please put them in the comment box. I'll be happy to read them and answer them in our next video. Thank you.